Rifampin 600 mg intravenous solution rifamycins is used to prevent and treat tuberculosis and other bacterial infections. It belongs to a class of drugs known as rifamycin antibiotics and works by stopping the growth of bacteria. It is important to note that this medication treats only bacterial infections and will not work for viral infections such as the common cold or flu. Using antibiotics when they are not needed can cause them to not work for future infections. The dosage and timing for this medication should be determined by a healthcare professional. This medication is administered through an injection into a vein, as directed by your doctor, typically once or twice daily. It should be injected slowly over a 30-minute period. If you are using this medication at home, it's important to learn all preparation and usage instructions from your healthcare professional. Before using, check the product visually for any particles or discoloration. If you notice either of these, do not use the liquid. Make sure to learn how to store and discard medical supplies safely. The dosage and length of treatment will be determined based on your medical condition, weight, and how you respond to the treatment. It's crucial to keep using this medication, as well as any other medications used to treat tuberculosis, exactly as prescribed by your doctor. Don't skip any doses. For the best results, use this antibiotic at evenly spaced times. Try to use it at the same times every day to help you remember. Continue to use this medication until the full prescribed amount is finished, even if your symptoms improve after a few days. Stopping the medication too early may result in the infection returning. If your condition persists or worsens, make sure to inform your doctor. Rifampin 600 mg intravenous solution rifamycins may cause upset stomach, heartburn, nausea, or headache. It may also change the color of your urine, sweat, saliva, or tears, which is harmless and will go away when you stop taking the medication. However, it may cause permanent staining of your teeth and contact lenses. Remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the risks of side effects. Most people using this medication do not experience serious side effects. Contact your doctor immediately if you experience signs of kidney problems, mental/mood changes, unusual tiredness, easy bruising/bleeding, small red spots on the skin, joint pain/swelling, or new or worsening shortness of breath. Seek medical help right away if you experience chest pain or symptoms of liver damage such as nausea/vomiting, loss of appetite, stomach/abdominal pain, yellowing of the eyes/skin, or dark urine. It is important to tell your doctor right away if you develop diarrhea that doesn't stop, abdominal or stomach pain/cramping, or blood/mucus in your stool, as this may be a sign of a severe intestinal condition. This medication may also sometimes cause oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. A serious allergic reaction to this drug is rare, but seek medical help right away if you experience symptoms such as fever, new or worsening lymph node swelling, rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. If you notice any other effects not listed above, contact your doctor or pharmacist. Before using rifampin, it's important to let your doctor know if you have any allergies to rifampin or other rifamycins. This medication may contain inactive ingredients that could cause allergic reactions, so it's crucial to discuss this with your pharmacist. It's also important to inform your doctor about your medical history, especially if you have diabetes, liver problems, HIV infection, or a history of alcohol use. Speaking of alcohol, it's best to avoid alcoholic beverages while using rifampin, as it may increase the risk of liver disease. Rifampin may also affect the effectiveness of live bacterial vaccines, so be sure to let your healthcare professional know if you are using rifampin before getting any immunizations. If you are planning to have surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant women, rifampin should only be used when clearly needed, as it may increase the risk of bleeding in both the mother and infant during the last few weeks of pregnancy. It's important to discuss the risks and benefits with your doctor if you are pregnant and using rifampin. Lastly, rifampin passes into breast milk but is unlikely to harm a nursing infant. It's best to consult your doctor before breastfeeding if you are using rifampin. It's important to be aware of how rifampin can interact with other medications. If you're taking Rifampin, make sure to inform your doctor or pharmacist of any changes in your medication. Rifampin can affect how other medications work and may speed up the removal of certain drugs from your body. Some examples of drugs that may be affected by Rifampin include atovaquone, certain anti-cancer drugs, certain antifungals, certain calcium channel blockers, certain products used to treat chronic hepatitis C, and HIV medications, among others. It's also important to note that Rifampin may decrease the effectiveness of hormonal birth control, such as pills, patches, or rings, which could increase the risk of pregnancy. If you're using Rifampin, it's important to discuss with your doctor or pharmacist whether you should use reliable backup birth control methods. Additionally, Rifampin may interfere with certain lab tests, potentially causing false results. It may also make it harder for your body to get rid of certain chemicals used in gallbladder tests. Make sure to inform all lab personnel and doctors that you are taking Rifampin. If someone has taken too much Rifampin 600 mg intravenous solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It is important not to share this medication with others. Before starting to use this medication, you may need to undergo lab and/or medical tests, such as liver/kidney function, bilirubin, and complete blood count. These tests may also need to be done while you are using the medication, so it's important to keep all medical and lab appointments. This medication has been prescribed for your current condition only, so do not use it later for another infection unless your doctor tells you to. Make sure to take each dose of Rifampin 600 mg intravenous solution Rifamycins as directed by your doctor. If you happen to miss a dose, speak with your healthcare provider to establish a new dosing schedule. Avoid taking a double dose to make up for the missed one. Be sure to follow the storage instructions provided with the product and ask your pharmacist if you have any questions. Keep all medications out of reach of children and pets. Do not dispose of medications in the toilet or drain unless instructed to do so. When the product is expired or no longer needed, be sure to dispose of it properly. Ask your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.